Hi, everyone. Thank you for having me. So I'm a clinical neuropsychologist, so that means that I am a clinical psychologist. That is, is it not on? Is it on? Can you hear me now? Closer. Better? Perfect. Okay. So I'm a clinical psychologist who went through extra training in brain health. Thank you. And my specialty is late life disease. So diseases that we get in our 60s and 70s and 80s. Most often that is Alzheimer's disease, but as we'll talk later on, that encompasses a wide range of diseases. But first, before we start talking about disease, I want to talk about what's normal. What should all of us expect as we get older? How do our thinking abilities change? So I'm going to show you this graph a little bit later on. For now, I want us to focus on this red line up here. That's normal aging. So over time, our thinking abilities do change, but they change very slowly and gradually, and our thinking changes should not result in severe impairment. I bring this up because oftentimes I have patients in my clinic and I'm asking them about their family history, and they say, my mom, when she was in her 80s, she had some memory problems. She was a little bit wacky, but it was normal for age. It was just because she was getting older. That is not true. If someone has significant memory problems, that's usually the consequence of a disease. So I want us to be very clear that normal aging should not result in significant loss of thinking skills. So if I mapped everybody in this room, if I tested all of you every year for the next 10 or 15 years, what would it look like? Would it look like this red line? No, it looks like this, a total mess. There's not an easy way to make sense of this graph, but fortunately there are some very sophisticated statistical analyses that we can do to show that there are actually three general trends of cognitive change with age. 70% of people will experience a very slow, gradual decline, usually over the course of 17 to 20 years. Very, very gradual. About a quarter of us will be doing fine, but then we hit some sort of cliff and we start to experience significant change over the course of 3 or 4 years. And under 10% of people experience what we call rapid change. So under a year, their thinking abilities decline very, very fast. That's usually in the context of some sort of injury or disease, oftentimes like a stroke or a major surgery. What we know is that mental abilities decline very little, but they do decline gradually. Some abilities, as Dr. Lanata mentioned, actually improve with age. So things like your vocabulary, your fund of knowledge about the world. We don't expect for that to go away. Your wisdom will continue to increase until the day that you die. Serious memory loss, though, does indicate that likely there's a disease process present. So serious memory loss is not a consequence of aging. Aging alone doesn't cause changes in the brain that would cause that symptom. Anytime somebody experiences major change over the course of a few years, it's usually because of a disease. The two most common types of change of cognitive abilities in older adults is Alzheimer's disease. So about 60 to 80% of cases of dementia and cognitive impairment are due to Alzheimer's disease. So that's the biggest player in this game. The second big player is vascular disease, and that is something that Dr. Lanata also mentioned. You can have something big with a big artery in your brain, and that would be called a stroke. Or you can have several small strokes in your brain over time, maybe due to things like hypertension that's not well controlled, and that can also result in cognitive changes. So those two things are the two primary types of dementia. When you have both of those together, that's a really bad news. So those people tend to decline the worst. The good news in this talk, and the reason why I bring all of this up, is that we actually know that the amount of disease in somebody's brain does not predict very well the amount of symptoms that somebody shows. So somebody can have a lot of disease in their brain and show very little symptoms, or maybe show no symptoms at all. Whereas some people might have only a little bit of disease in their brain and they might show a lot of serious symptoms. So we know that there are things that we can do in our life for our brain that can change how our brain experiences a disease. So we know the disease matters. We also know it's not just the disease. So that leads us to, I want to go over the two main definitions that Dr. Lanata covered. I know we spent a lot of time in his talk. This is a big misconception in the public. I want to make sure all of you leave the room understanding the similarities and differences between dementia and Alzheimer's disease. Dementia is just a clinical description. When someone has dementia, it just means that they've had thinking changes so significant that they can no longer function independently in daily life. So they might need someone to help drive them, to manage their medications. Maybe somebody needs to pay their bills for them because they're missing bill payments. So their changes are so significant that they now need help. There are a lot of causes of dementia, over 200 causes of dementia, the main being Alzheimer's disease, of course. But when someone comes into my clinic and I give them a diagnosis of dementia, I then have to say what's causing the dementia. The category below that is mild cognitive impairment. Mild cognitive impairment means that somebody's had changes that are above and beyond what we would expect with their age, but they're not so significant that they can't function in daily life on their own. So the thinking changes are still pretty mild. Around 15 to 20% of adults age 65 and over meet criteria for a diagnosis of mild cognitive impairment. That group is at greater risk for going on to develop dementia. There are a number of different causes of mild cognitive impairment. If it's due to something like Alzheimer's disease, we would expect that they will continue to progress over time, and they will likely develop dementia if they live long enough. Some causes of cognitive impairment, though, are reversible, things like thyroid function, mood, sleep disturbance. So it's important to get assessed because we need to figure out what's causing the cognitive changes, and that'll help us predict your future. Again, this is just graphically to show that dementia is an umbrella term, and it can be caused by any number of diseases, as is mild cognitive impairment, an umbrella term. It's just describing what's going on with your symptoms. So it goes back to this slide. So we see that normal aging, the red line up top, people decline a little bit, but they still are functioning independently. Mild cognitive impairment, that group starts to peel off, usually in their 60s, in their 70s, and if it progresses, they go on to develop dementia. So how do we stay on that red line? What can we do to prevent cognitive decline? There are a number of factors that we're going to talk about today. The big theme, though, that anything that is good for your heart is good for your brain. So risk factors like hypertension, high cholesterol, diabetes, your mood has a significant impact on your brain health. Sleep, head injury, avoiding head injuries, medication, actually hearing loss puts you at greater risk for cognitive impairment, and your health habits. So how active you are. Do you smoke? Do you drink too much? We're going to start with exercise, though. And I know that you have a talk after this specifically on exercise. So I'm not going to go into great detail because I don't want to steal too much thunder. But I do think it's important for me to mention that older adults who are less active are more likely to develop cognitive impairment and dementia. And in this study, they divided people into 4 groups. People who don't exercise at all, people who exercise a little bit, people who exercise a moderate amount, and people who exercise a lot. And they compared them over time, over about 7 years, who's at greatest risk for developing dementia of any type, Alzheimer's dementia, or mild cognitive impairment. And I know in the back you probably can't read this very clearly, but the blue bar here, the no exercise group, regardless of outcome, they were always about 60% more likely to develop any of these conditions. What's most fascinating, though, is between the low exercise group, the moderate exercise group, and the high exercise group, there wasn't that significant of a difference. There is a trend where the high exercise group is at the least risk, but the difference between these bars is right here is much, much less than the difference with the blue bars. So the point here is that any exercise is better than none, even if it's a little bit. Do something. Another study done here in the Bay Area by a researcher named Christine Yaffe, who's at UCSF in the San Francisco VA, she looked at 6,000 women over age 65, and she just asked them, how much do you walk? And they figured out how many blocks each of these women walked, and they followed them over the course of 7 years. She found this beautiful, beautiful result and found that the women who walked the most declined the least. The women who walked the least declined the most. So again, anything is better than nothing, but there does appear to be some dose-response relationship where the more you do, the better. And again, pointing out here that walking is the exercise that they're doing here. These aren't people who are training for marathons or going to the gym for hours a day. This is just walking in your community. So part of today's talk is figuring out how can we apply what we know about the research to your daily life. So what should you do for exercise? The literature on the exact right type of exercise and the right amount is a little bit mixed. Generally in our clinic, we recommend 30 minutes of moderate intensity exercise about 5 days a week. Moderate intensity means that it's strenuous enough that you can't sing during it, which you shouldn't be singing while you exercise anyway. But it's not so strenuous that you can't talk. So you should be able to comfortably talk while you're exercising. That's how you can tell if it's moderate intensity. You have to build it into your schedule. You can't just do it at the end of the day if you have time. You really need to block off a part of your day and say that no matter what, from 11:30 to 12, I'm doing laps around the neighborhood. For those of you who don't like going to the gym, there are plenty of ways that you can exercise in your community or build it into your day. Things like parking further from the door, taking the stairs, jogging, swimming, going dancing with friends or with your partner. Referring back to the 2 previous slides, though, if you can't get in 30 minutes, don't just say, okay, well, I can't exercise today. Anything helps. If you can't do 30 minutes, do 20 minutes. If you can't do 20 minutes, do 5 minutes. All of this adds up over time. So do what you can. And we'll move on to diet. Diet is a big topic in our clinic. I have a lot of patients coming in because there are a lot of direct-to-consumer marketing for different vitamins and supplements and nutrients that have promised to protect your brain for eternity. I don't like to be the bearer of bad news, but any specific dietary component, the research that's been done has shown that there's no one magic bullet in your diet. For a while, we looked at turmeric because it was thought that maybe India had fewer cases of Alzheimer's disease. So we thought, what's going on in India? What are they eating? So we thought maybe it's turmeric or curry powder. It was found that that's not it. And actually, Alzheimer's in India is just as common as it is anywhere else. Ginkgo biloba had a hot couple years. Now there are things that you see on television all the time promising this stuff. Be cautious, let your doctors know what you're taking, but just so you know, there is not a lot of research support behind any one dietary component. The scientific community is actually now moving more towards a whole diet approach because we know that different parts of your diet interact with each other and they interact with the body differently. The 2 main studied diets with regard to brain health are going to be the Mediterranean diet and the DASH diet, or the dietary approach to stop hypertension. Most of you have probably heard of the Mediterranean diet in some form. Probably fewer of you have heard of the DASH diet unless you're on it. But we'll walk through what these food pyramids look like. In the Mediterranean diet, the biggest takeaway here is that the main thing you should be eating is fruits, vegetables, and healthy fats. Healthy fats being olive oil, avocado, nuts, seeds. A few times a week, you want to have some form of seafood. It's thought that the omega-3s in seafood might have a protective effect with the brain. Only a couple times per week should you actually be having dairy and poultry. So dairy and poultry have a very small representation in this diet. And even less than that, so maybe once a week, are things like red meats and sweets, so desserts. This diet also became famous for its encouragement of wine consumption in moderation. So for women, that means 1 glass, usually about five days per week. For men, that can be up to 2 glasses. Anyone who's pouring their own glasses of wine, I encourage you to measure out how much you're pouring, because people often come into my clinic and they say that they drink 1 glass of wine per night, and I have them pour me what their glass looks like, and they're drinking solidly 2 glasses of wine. So I understand if you want to have a generous pour at home, but just be mindful of how much you're drinking. The next diet, the DASH diet, the bottom here is actually the same. Fruits and vegetables should be the main part of your diet. Leafy greens, fresh fruits. The rest of the pyramid, though, is flipped a little bit. So here they encourage more regular intake of grains, and they actually say that you should, a few times a week, have dairy and meat. They don't differentiate here between seafood and other lean meats. And they actually recommend fewer servings of healthy fats and nuts. And again, on top, limit your sweets, limit your desserts. So what diet's best? Which one should you do? In an interesting study that compared the two diets head to head, they looked at people who were doing the Mediterranean diet, people who were doing the DASH diet. They divided both groups into how strict you are with your diet, into tertiles, so into three groups. They looked at people who were the strictest with their diet, people who cheated a little bit but were generally pretty good, and people who cheated all the time. And they saw, those of you in the back, you can't tell, this top line right here is the group that was most adherent. You can see these graphs look almost identical. So it was found that the best diet for you is the diet you can stick to. So those who are strictest with their diet, regardless of what the diet was, declined the least. So don't adopt a diet if you can't do it. Find a diet that you're going to be able to fit into your lifestyle and go with that. So what should you do? Increase your vegetable intake is a consistent. Everybody's in agreement that vegetables should be the main thing in your diet. How do you do that? I recommend all of my patients incorporate salads with dinners, regardless of what you're having. Get in the habit of having leafy greens with your dinners every night. Pick a day of the week where you don't have any meat so that you can at least guarantee that that day you're increasing your vegetable intake. And I have plenty of patients who come and they say, I have not eaten vegetables for the first 80 years of my life. I'm not going to start now. And for that, you still have to do it. So we just have to find ways to trick your body into doing it. So we recommend drinking your vegetables. If you really can't stand eating them, put them in a smoothie, hide it with some fruit and some milk. Drinking it might be a quicker way to choke it down. We do recommend increase your fruit intake, but watch out. The fruits vary in how much sugar they have, and oftentimes we recommend to treat fruits as a dessert. So use fruit as a dessert, have it fresh, have it baked, mix it up. Be careful not to substitute drinking juice for eating fruit. Drinking juice, you do get a lot of the vitamins and the nutrients of it, but you get all of the sugar and none of the fiber. So in a bottle of orange juice, it's almost as if you're eating like 5 or 6 oranges. You're getting all of the sugar from those oranges, but you're getting none of the fiber. And you probably wouldn't sit down and eat 5 oranges. But when you drink juice, that's what you're doing. Increase your healthy fats, so things like your nuts, your olive oil, your fishes. Focus on whole grains. So if you're someone who loves the white breads, loves the white rice, try to go beyond that into the whole grains or brown rice. Limit your sugar intake, and then stay hydrated. This is something that isn't talked about enough, but should be. If you are dehydrated, you increase your risk of developing infections and illness. Your brain needs to be hydrated to function well. So an easy rule to remember is called the 8x8 rule. And so that is to drink 8 glasses of water 8 times a day. I always recommend people have a glass of water immediately upon waking. So especially if the first thing that you're going to do is make coffee, which is going to dehydrate you, have a glass of water first, okay? I have my water here so that I remember to drink water throughout the day, because that's my next point, is that you need to have water with you throughout the day. If you don't have water with you, you're not going to drink it. You're not going to remember it. You might get to the end of the day and realize you only had a few glasses of water. That is bad for your body. It's bad for your brain. However, for those of you, especially the men in the room, who might have problems with frequent urination in the night, be mindful of your water intake or your liquid intake after 3 p.m. After that point, you start to increase your risk of having disrupted sleep. All right, and now we're on to sleep. Sleep is critical for the brain. It helps the brain form new memories. It also helps us repair injured cells and tissue. Poor sleep has been linked with almost every dementia, almost every type of dementia. But what we don't know is to what extent this reflects a risk factor, or is this an early symptom of the disease? So the research is still emerging in this area. There was one study, though, that compared different types of sleepers. So they broke sleepers into 3 groups. The healthy sleepers, so people who sleep 6 to 8 hours per night, which is what we generally recommend. Short sleepers, people who sleep under 6 hours, and long sleepers, people who sleep more than 8 hours per night. And what we found here, that unlike the other factors that we've talked about before, like exercise, it's not a dose response relationship. The more you do is not better. It looked like short sleepers and long sleepers, they were actually at the same level of increased risk compared to healthy sleepers to develop dementia over the course of 7 years. So if you're not sleeping enough, or if you're sleeping too much, those are things that we should be concerned about. People who are sleeping more than 8 hours at night and still wake up feeling tired, that's usually indicative of another medical process going on. So talk to your doctors. If you're sleeping 8 hours, 9 hours, 10 hours per night, and you're still exhausted when you wake up, we need to figure out what's going on. For people who have sleep apnea, this is very common, and it's because the brain is not getting good sleep at night, and it's not getting refreshed. So even though you're in bed for 8 hours and you feel like you're asleep, your brain actually doesn't get 8 hours of rest during that time. So talk to your doctor if you're sleeping more than 8 hours and are still tired. So what should you do? Sleep hygiene is critical. So schedule your bedtime and your wake time and be consistent. You should be getting in bed within 30 minutes of the same time every night. So pick a time and stick with it. Also pick a wake time. So if you get in bed at 10 and you want to wake up at 6, every day you should be sticking to that schedule. Once you get off that schedule, your body loses the relationships that it's learned. No digital screens for about 30 minutes prior to going to bed. So that's going to be things like your phone, your computer, your iPad, even the television. Give your brain a break. Give your eyes a break. If you go straight from watching your screen to getting into bed, you're still a little stimulated. Your eyes are turned on, your brain's turned on, processing what you just saw or what you just read. So give your brain a break. Importantly, your bed should only be for sleeping. You should not be reading in bed, which I know a lot of you are guilty of. You should not be watching TV in bed. You certainly should not be eating in bed, because our body learns relationships, and we want our body to learn the relationship that when we're in bed, its job is to sleep. If we do these other things in bed, when we get into bed, it doesn't know what to do. Am I supposed to be reading right now? Am I supposed to be sleeping right now? And so your bed should only be for sleeping. If you can't sleep after 20 minutes, if you get into bed, you're laying there, you can't sleep after 20 minutes, instead of ruminating about how you can never sleep, get out of bed. Get out of bed, do something mindless, fold the laundry, dim light, do something boring. Eventually, you will feel tired. When you feel tired, go back to bed. Repeat that cycle. You will have to sleep. We all have to sleep. So at some point, your body will give in. And the first few days of this can be kind of painful, but it's really important that you force your body to sleep when it's in bed so that it knows when you get into bed, it sleeps. In the morning, even if you had a bad night of sleep, stick to your wake time. So get up, even if you're exhausted. If you don't, if you wake up at 10, 11, 12, that night, when you go back to fall asleep, you're not going to be tired anymore. And so you do need to build up what's called sleep debt. Even if you're tired, get up. Limit the daytime naps. If you really, really, really need a nap, take it, obviously, but you don't want to replace your nighttime sleeping for daytime sleeping. That is when people can get into a problem where they say, I slept for 2 hours during the day and then at night I couldn't fall asleep. Of course you couldn't fall asleep because you already slept during the day. So you really need to make sure that you build up that sleep debt during the day so that when you get into bed, you fall asleep right away. Importantly, if you have sleep issues, figure out why, and we need to treat these issues. The three main issues that we see are mood. So people get into bed and they start ruminating. They're anxious about things that they have to do. They're worried about finances. They're worried about the North Korea summit. And so there are a lot of things that people might want to be worried about, and that's okay. But if you're having these concerns, you need to treat your mood because we can't let your sleep suffer because your mood is suffering. Frequent bathroom breaks. This happens most often in men. It can also happen in women as we get older. If you get up a lot during the night to use the bathroom, it disrupts your sleep. It's harder to fall back asleep. Monitor your liquids in the afternoon. So usually around 3 p.m., you should start to wind down your drinking for the day. And then there's something called the double void technique. So that means right before you go to bed, you should go to the bathroom. Literally 2 minutes later, you should try to go to the bathroom again. You want to make sure that your bladder is as empty as possible. Even if you don't feel like you need to go to the bathroom again, try anyway, because you'll be surprised what your body can produce in a time of need. There are also medications that can be prescribed for this, so talk to your doctor if this continues to be a problem. Again, we don't want your sleep to suffer because of a medical condition. Pain is another one. So a lot of people, they have back pain, they have neck pain, they have knee pain, and that disrupts their sleep. Physical therapy, there are also psychotherapy. There are what are called pain psychologists that can help work with you to change how your body perceives pain and adapts to pain. Of course, there are medications as well. One thing that I want to point out here, though, that any of the medications that end with a PM, so things like Tylenol PM, Aleve PM, Advil PM, those generally are pretty bad for your brain, especially after the age of 60. We really, really want to reduce our how often we take those. Some people get in the habit of taking those almost every night for chronic hip pain. That is bad. So if you need to take a pain medication, there are safer alternatives. Do talk to your doctor about it. We want to steer clear, though, from these PM medications and things like Ambien. Those increase your risk for cognitive impairment. They increase your risk for dementia. They also increase your risk for falls in the middle of the night. So if you do get up in the middle of the night and you're on Ambien and you go to the bathroom, you're at a greater risk of falling and breaking your hip. Then you go to the hospital, you have to have a surgery, and then you develop a host of other problems. So really, really, really be mindful about what medications you're taking for sleep, and talk to your doctor about all of this. Now I'm going to move on to health habits. So smoking is the biggest health habit because we know that smoking is associated with 1 million negative health consequences, Alzheimer's disease being one of them. Current smokers have an 80% increased risk of developing Alzheimer's disease than non-smokers. That is shocking. Again, though, anything that's bad for your heart is bad for your brain. So we know that smoking is terrible for your lungs, terrible for your heart. So it doesn't come conceptually as a huge surprise that it'll also put you at this increased risk. What is most shocking, though, current smokers have a 70% increased risk of developing Alzheimer's disease compared to former smokers. That is shocking because that means that if you quit, a lot of the damage that you've done can be reversed. You might not go back to the state of someone who's never smoked before, but that's a giant, giant drop in risk reduction. Point here is it's never too late to stop. So if you're in the room, you smoke, know that there's still benefits to quitting or even cutting down. Again, the focus here, do what you can. Don't not do anything because you feel like you can't do it all the way. Do what you can. Alcohol, bearer of bad news again. There's been a long push for alcohol use as potentially reducing your risk for developing Alzheimer's disease and dementia. It's been in the news for literally 10 years. Literature is still a little bit mixed here. For a while, we thought it was specific to red wine. Now it seems like it might not be specific to red wine. It might just be alcohol in general. There is some literature. So Dr. Lanata talked about what a meta-analysis is. So a meta-analysis combines all of the findings out there into one study and just integrates those results into one takeaway point. Unfortunately, the literature is so muddy that what we found is it's probably a small or moderate benefit, if anything. We know that it's probably not going to do any damage as long as you're drinking within your limits. So that's, again, 1 drink for women a day, 2 drinks for men. The research, though, it's not strong enough to suggest that people who don't drink should start. So if you don't drink, I'm not saying that you should drink. If you do drink, it might be beneficial. It might have a modest benefit, but it's just not so compelling that we should all start drinking heavily right now. So now I'm going to move on to heart health. Again, anything that's bad for your heart is bad for your brain. I hope that that's a clear takeaway. So all of the conditions that you have medications for, your diabetes, your hypertension, your high cholesterol, be very strict with those. Because I know sometimes it can feel as if these are just random conditions you have to take a pill for. You're not really sure what the outcome is if you don't. The outcome is you could develop Alzheimer's disease because you're not controlling your heart risk factors. So all of these conditions not controlled increase your risk for cognitive impairment and dementia. One interesting finding over the past few years is we found that people with hearing loss are actually at increased risk for developing dementia as well. It doesn't seem to be specific to verbal or auditory memory. It's anything. So I could show someone with hearing loss a visual memory test, and they would do worse on that as well. We're not entirely sure why this is. This is still an emerging area of research, but the part of the brain responsible for hearing is right beside the part of the brain that's responsible for memory, so the hippocampus. It's thought that as the connections to hearing die off in the brain because of hearing loss, that might spread into the part of the brain responsible for memory. Also, people with hearing loss tend to isolate. They socially restrict themselves. They feel frustrated in social situations, so they stop doing things. We know that that puts you at greater risk for developing dementia as well. So we're not sure what the causal mechanism is here, but we do know that individuals with hearing loss, they decline faster and they have higher rates of dementia. And risk of dementia is also linearly associated with the degree to hearing loss. So people with the greatest hearing loss also have the greatest risk of dementia. People with the least hearing loss have the lowest risk of dementia. So what should you do with your health? Treat all of your medical conditions and be very serious about that. Manage those conditions tightly with medications and with lifestyle. Don't smoke. So if you don't smoke now, definitely don't start. If you do smoke now, start working toward reducing your smoking, ideally quitting if possible. But again, do what's in your capacity. Stay on top of hearing evaluations. A lot of you in this room have Medicare. Medicare covers hearing evaluations typically annually. So consider this as a baseline. Even if you don't feel like you have hearing loss, get it checked out anyway, because sometimes you'll be surprised. If you have hearing aids, wear them. Now I'm going to talk about a concept called cognitive reserve. So cognitive reserve is a very fascinating subject, and it's something that the scientific community has really been focusing on. Cognitive reserve refers to the idea that the amount of brain damage that the brain can take before it starts showing symptoms. So what we know is that people with high cognitive reserve, it takes a lot longer for them to have symptoms. And the amount of disease in someone's brain does not perfectly predict how much symptoms somebody has because of this concept of cognitive reserve. So again, we know that some people with a little bit of disease can have a lot of symptoms, typically because they have low reserve. Someone with a lot of disease can have almost no symptoms, typically because of high cognitive reserve. In a very fascinating study done with about 700 nuns, they tracked them over the course of their life. And they found on autopsy, so they donated their brains to the study, on autopsy, nearly a third of the nuns had Alzheimer's disease on autopsy, but showed no symptoms during their life. That finding means that probably there are a number of people in this room who have Alzheimer's disease in their brains, but are not showing any symptoms right now. So the goal of a lot of the treatment focus right now is really, we might not be able to cure the disease, but can we push the symptom onset so late that we effectively get rid of the disease or get rid of how it impacts our daily life. So what are some factors that can influence your reserve? People with high education generally have higher reserve. People with higher IQ have higher reserve. Those who have a very complicated or complex occupation where they're having to use their brain a lot have higher reserve, and genetics. The last activity here is participation in mentally and socially stimulating activities. I know a lot of people in this room might be retired and you're thinking, what am I supposed to do? I've already finished my education. My IQ is sort of set. I can't change what I did for work. So what we're focusing on here is participation in these activities. We know that the brain is just like a muscle, so you have to use it or you're going to lose it. So just like if you don't go to the gym and then all of a sudden you go to the gym, it's going to be very hard for you to do things. If you do not use your brain and then all of a sudden you're being asked to use your brain, it will be much harder for you. So you need to constantly, on a daily basis, be challenging yourself. Research has shown that these cognitively stimulating activities and hobbies, people who participate in those the most have the lowest risk of dementia. So what should you do? Find activities that bring you passion. So the best activities that you do are going to be ones that are cognitively challenging, but also involve some sort of emotional component, things that get your whole spirit involved in the activity. You want the activities to be challenging enough that they're hard, but not so challenging that you're frustrated or don't want to do them because they're not fun. So do not do activities just for the sake of doing them. I get a lot of patients who come to my clinic and they say, don't worry, I do crosswords every day and I'm feeling pretty good. That's fine, but if you hate doing crosswords, it's not going to help. So don't do crosswords just because you think crosswords are supposed to help your brain. They will, if you like doing crosswords, they may. If you do not like doing crosswords, find something else to do with that 30 minutes or a couple hours, depending on how good you are at crosswords. So some ideas of activities, grandparenting. There have been some interesting studies that have shown that people who are grandparents and play an active role in their grandkids' lives actually are at lower risk of developing cognitive changes. And that's probably because their brain is so active. You're having to keep track of a 2-year-old playing with cars while your 6-year-old's running into the kitchen. You're challenging your brain in a real life way. And again, it's tapping the emotional component. So you have an emotional investment in doing well in this task. Dog walking is another idea of an activity. So volunteering at the animal shelter is always looking for volunteers, finding things that keep you active. Another interesting and fun option that I used to do at the hospital I worked at in Boston is something called memoir writing. Memoir writing refers to the idea of you writing your story down. So you writing your life story. If you have free time at home, please do this. Your kids will thank you, your grandkids will thank you, your friends will thank you, because in 20, 30, 50 years, you may not be around to tell your story and to impart your wisdom. And this is a really fun way to keep you engaged because it's like writing your autobiography. Gardening is another good one. It keeps you physically active, but also there's a cognitive engagement component there as well. And then volunteering. There are a lot of organizations in the Bay Area that are looking for volunteers. One of the common complaints I get from patients is that they feel like they don't have any meaning. They feel once that they've retired, they don't know what their purpose is. Please find your purpose. You do have purpose. You do have value. Please do use it because there are a lot of organizations here that could use your help. Dr. Lanata mentioned this as well. It's important to stay social. Research has shown that those who endorse experiencing loneliness are at around a 64% increased risk of developing dementia. Important here, loneliness does not mean the same thing as being alone, though. So some people actually enjoy being alone. There are plenty of introverts who they feel stressed with having people around and they feel comfortable being alone. That's okay. But for those people who endorse feeling lonely, that specific feeling seems to put people at greater risk. Why that is, we don't really know, but we know that if you feel lonely, that is something that we need to correct. Along these lines, check in on those around you. So ask friends, ask family, especially if people are going through loss, they have got medical issues, things that can bring people's mood down. As we get older, sometimes it can get harder to leave the home. Maintain phone contact with friends. Just make sure that you keep your community alive. Be proactive in this area. Go to the senior center. Go to the JCC. Organize outings. Volunteer. So I want to summarize part one. Brain health impacted by genetic, lifestyle, and medical factors. How you treat your brain across your life accumulates. So you need to start treating your brain very well starting now because how you treat your brain now will impact it in 5, 10, 50 years. Anything that's good for your heart is good for your brain. Eat well, exercise, don't smoke, and stay engaged in the world around you. Now I want to move on to compensatory strategies. I'm going to zoom through some of this because I know I'm running a little short on time. So one thing that I want to be clear on is a lot of people feel like memory loss is true memory. Most of the time when people feel like they're having memory problems, it's actually due to problems with attention. So attention and memory are very related. So let me give you an example. You get home, you're rushing to let the dog out back, you throw your keys on the couch. A couple hours later, you need to go to the store. Where are your keys? Did you forget where your keys are? No, you never forgot where your keys are. You never remembered where your keys were in the first place. You never learned that. So that is an example. that is not memory loss. That is not paying attention. And a lot of times people feel like they're having memory problems when really they're having attention problems and disorganization problems. Okay, so some tips. First, minimize distractions by organizing your environment. This is not my office. This is someone's office, so I won't name, but it's chaotic. There's so much stuff. So we need to think about attention as a pie, as a nice cherry pie. Anything in your environment that takes some of your attention away takes a piece of that pie. All of this is taking out piece of pie, all of this. By the end of the day, there's almost no pie left. Change that, remain organized, have an organized environment. The cleaner your space is, get rid of clutter, the easier it will be for you to pay attention and remember. An important thing for all of you in the room, if you are not using a Pillbox, today is the day. Go buy a Pillbox before you go home. People should not be taking pills out of their pill bottles. It is impossible to remember if you've taken your medications this way. You may be doing fine now. Maybe you only have one medication now. You need to start building healthy habits today. So pill boxes are important because people who don't use a pill box, they're at greater risk of missing doses, of doubling doses, and making mistakes in their medications. If you miss your hypertension medication, guess what? Now your hypertension's not controlled and you're at greater risk of Alzheimer's disease. So it really goes back to the idea you have to be very, very strict with this. Pill boxes are great. It helps you keep track of this information over time. Even if you have no memory problems now, learn the habit, because in 5 years or 10 years, if you do develop memory problems, this will be second nature for you. You will be so used to taking your medications. When you have memory loss, it is impossible to keep track of this task. All right, so these come in different forms. Look how many pill bottles there are. I have patients who come in, they're on 10 pills, 12 pills a day, and they say that they're totally fine taking them out of the bottle. I would bet my life that they make mistakes. There's just no way that any of us could be that organized. So they have dailies, there are monthlies, multiple times per day, even electronic pill boxes. Find what works for you. Do not take your pills out of the bottles. So again, you have to stay organized, keep your environment clean, use things like calendars to keep your environment, keep your space organized, file drawers. If everything has its correct place, you'll be able to find it easier. So in my house, I'm notorious for losing my keys. When I get home, I have a key hook now right by the door. I always put my keys on the key hook so that when I leave, I don't have to think about which couch did I throw my keys on. I know that I put it on my key hook, and that took months to learn. It was not easy, but now I do it with ease, and I haven't lost my keys in years. Okay, so some strategies. I want to specifically talk about calendar, daily planners, and memory tables. If you don't have a calendar, if you don't use a calendar, you must. I generally recommend having just one calendar, but if you have more than one, just make sure that you sync up. So choose a master calendar. I like to have a calendar that I can carry with me to things. So I prefer to either use your phone or have some sort of paper version that you can take with you in your purse so that you can write things in it as it comes up. Put appointments in your calendar immediately. So even if you take a card from the doctor's office, before you leave the waiting room, put it in your calendar. You're increasing your risk of forgetting if you don't get in the habit of doing it right away. People who don't have their bills on auto pay, I also recommend all of my patients put all of their bill due dates on their calendar a few days before the bill is supposed to be due. Also put that on your calendar so that you should have at least 2 reminders before every bill is due. Daily planner, stay organized with your time, make to-do lists, check it throughout the day, and put the activities in highest priority. Then there's something called a memory table. A memory table it's sort of like a key hook, but it can be anything that you lose frequently. So your glasses, your wallet, your purse. It can either be something that you buy, or you can choose a container, a large bowl at home. That's where I put my wallet when I get home. I have a bowl right by the door. Again, I just put my wallet in it right away. Anything that you lose with frequency, you need to develop a specific place where you decide to store it. It goes there every day. You leave it there. You get it from there every day. Get in the habit of being consistent. All right. So these are some examples of memory tables. You can buy them online. I think that's sort of silly, but if you want to, you can. You can also just find a bowl or some sort of container at home. Another strategy, remembering names. So forgetting names is one of the most common complaints that we get in with aging. Some strategies, when you meet a new acquaintance, repeat the person's name in your mind, but also out loud. So most of the time when someone comes and introduces yourself, reflexively, you probably introduce yourself. Let's change that. So now when someone comes and says, "Hi, I'm John," instead of immediately saying, "Hi, I'm Caitlin," which is what most of us do, say, "Hi, John, I'm Caitlin." Say it out loud. In conversation, also use it. So instead of saying, "So what do you do for work?" "John, what do you do for work?" "John, what do you live?" Research has also shown that people actually like being talked to that way too. So it'll help your social skills as well, but use it in conversation multiple times if you can. If somebody walks past, introduce your new acquaintance to your spouse, to your friend. "Hey, honey, did you meet John? He lives next door." So the more that you say it out loud, the easier it'll be to remember. Another thing I want to talk about, your mindset. Research has shown that how we view aging affects our memory. People in cultures that have a positive view on aging actually do better on memory tests. Older adults who have been exposed to negative words like senile and confused, they do worse on memory tests than older adults who are exposed to words like sage and wisdom. And people that have more positive views on aging, they actually live longer. They live almost 8 years longer than people who find aging to be a real drag. So try to change your mindset if you can. I'm going to talk about anxiety. Probably most of you have felt this. When you're stressed, you cannot remember information very well. You can't focus very well. So anxiety is a big contributor to cognitive difficulties. So again, in social situations, you can't remember names. Oftentimes that's because you're anxious in that social situation that you never learned the name to begin with. So it's not so much a memory issue anymore. It's really, you're not learning. And mood. Depression and cognitive difficulties are tightly related. So individuals who are depressed have more memory difficulties than individuals who are not depressed. And interestingly, in the brain, the part of the brain that's responsible for memory, so the hippocampus, people who are depressed tend to have smaller hippocampi than people who are not depressed. So there also seems to be some sort of biological mechanism that may be explaining this. But depression, it affects how you feel about yourself. It also affects how you feel about your cognitive abilities. Oftentimes people feel like they have memory loss when they just have low mood. Seek help. This is a big issue. If you have problems with your mood, talk to your doctor, talk to a therapist, talk to your family, talk to your friends. I want to pause here because since I submitted these slides on Wednesday, we had 2 very high-profile suicides with Kate Spade on Wednesday and Anthony Bourdain on Friday. And I bring that up because adults in midlife, they're actually at the greatest risk of suicide. But the second group at greatest risk of suicide, older adults. So adults over age 85, particularly white men in that group. So I bring this up because suicide is not something that goes away when you're young, that there are probably people in this room who have had thoughts like that, especially when the idea of something like Alzheimer's disease gets brought up. It is very common for me to have patients who say, if I get diagnosed with Alzheimer's disease, I'm going to kill myself. I encourage all of you to, if you came here with someone and you leave here with them, talk to each other, check in, ask specifically, have you had thoughts about killing yourself? How is your mood? Especially if they've had some medical changes recently, that puts them at great risk. So again, it takes a village. Be part of that village. Check in on each other. So part 2 summary, attention strongly related to memory. If you have problems with your attention, you're going to have problems with your memory. Stay organized. This is one way to prevent memory loss in your daily life, is keep your environment as free of clutter as possible. Use external strategies. Use an alarm. Use a calendar. Use a memory table or a Pillbox. Again, think of your cognitive abilities as a pie. The more that you support your abilities, the more pie you have left to do things in your daily life. The more that you have to think, oh, did I pay my bill yet? If you're relying on your memory yourself, you're taking pieces of the pie day after day after day. Have a healthy mindset. Take care of your mood. This last part is what do you do if you feel like you have memory loss? So some of you in this room might already feel like things have changed for you and you're not really sure. So this is what's called subjective memory loss. And so this is your practical approach of what to do next. Subjective memory loss just means that you feel like you've had memory changes, but maybe people around you haven't said anything or haven't expressed concern, but you know that things are harder now. It was once thought that people who have subjective memory loss were probably fine and that they probably just have depression. It's now known, though, that that's not true. So in Alzheimer's disease, for example, one of the main symptoms is this loss of insight into one's difficulties. So a lot of people with Alzheimer's disease have no idea that they have memory loss. And in fact, they would deny that if you told them that they have memory problems. So it was thought that if someone has insight, well, they can't have Alzheimer's disease. That's not true. Recent studies have shown that individuals with subjective concerns about their memory actually tend to do a little bit worse on memory testing. So there's some kernel of truth. There's some portion of the population that seems to be very perceptive of changes in their own brain. And so not everyone, though, that has these concerns will actually have memory loss on testing. So some people will just have depression or will look fully fine on testing, and this can be good news for them. But what should you do if you have this concern? Talk to your primary care doctor about this. Be very firm with your concerns. Most primary care doctors, especially if they're not trained in geriatrics, they don't know how to tell the difference between normal aging and mild cognitive impairment. So these early years when your brain starts to change, your primary care doctor might think that it's normal for age. And he might say, yeah, you're fine, don't worry. If you have concerns, get tested. Do not let him tell you or her tell you that you're fine. So talk to your primary care doctor. A workup for cognitive impairment, it might include cognitive testing, might involve lab work, looking for some reversible causes of cognitive impairment, and it might involve brain imaging. So oftentimes you get referred to see a neuropsychologist like me or a neurologist like Dr. Lanata. And just so you know, Medicare generally pays for these evaluations. So a lot of primary care doctors don't know this either. And so they often don't refer out for this because they feel like their patient's fine. They don't want their patient to pay money for this. And so they don't do anything about it. It is routine for me in my clinic to get patients who have been complaining of cognitive concerns to their doctor for years. And the doctor didn't think anything was wrong. By the time they come to see me, they've already surpassed that mild cognitive impairment stage and they're in the early dementia stage. The problem with this is that early diagnosis matters. There are medications out there. They don't treat the disease, but they do treat the symptoms. Starting those as early as possible is important. So what's a neuropsychological evaluation? A neuropsychological evaluation, it's objective evaluation of your cognitive abilities. So things like your memory, your language, your speed, your visual skills. And you're compared on those tests to people of a similar age and background to you. So similar age and education. And we see how do you do on those tests compared to how do we think you should do on those tests. Is this normal aging or is this disease? This is especially important for people who have high education, high IQ, and low education and low IQ. It's really hard for primary care doctors to tell the difference in those two groups. Most diseases have what we call a signature on testing. So as Dr. Lanata pointed out, Alzheimer's disease typically affects the memory. It also tends to affect language and word finding. Things like Parkinson's disease might have a more visual component, a more motor component. And so we can tell how you do on testing that usually maps on to a certain disease process. So why does early diagnosis matter? Again, early diagnosis is critical because it allows us to start medications if needed as soon as possible. It allows for your lifestyle to be modified. Sometimes you have cognitive changes because of something that we can treat, and we should treat those changes if possible. And if it does turn out that maybe something like Alzheimer's disease is present, it helps for planning. So it helps for financial planning. What's your family gonna do in the next 5, 10, 15 years? How do you wanna handle this? It also helps for life planning. Are you still working? Do you wanna retire? Did you always wanna go to see Thailand? Now is probably the time. So it helps you figure out what do you want to do in your remaining years? How much time does your brain have left? And how can we work with that? Last slide, concern about others. So like I said, oftentimes people with Alzheimer's disease don't know that they're having memory problems. And actually, if you approach them on it, they might get combative because they genuinely don't experience what you're experiencing. So they may deny symptoms, and that's okay. Don't challenge them on this. Don't prove them that they're wrong. That generally doesn't help. But it is important to alert those around them, and including their healthcare team. If they go to the doctor and they don't complain of symptoms, your primary care doctor has about 5 minutes with you. And so if you come in and you have diabetes that's not well controlled, they're going to focus those 5 minutes on your diabetes, and they're not going to ask how your memory is. So if you're concerned about someone's memory and they won't let you go to the appointment, call their doctor in advance. It needs to get into their medical record. Be their healthcare advocate, because they might not be able to do that for themselves at this point. All right, I think I'm at the end. I know I'm running close on time, but I'm happy to answer any questions if you have them.
I think we have time for one question.
Okay. I will also say that I will be at the back to answer any other questions, and I apologize. Yeah. Oh, sorry. Go ahead.
Hi. I was wondering on the smoking aspect, how does marijuana or vape
Great question. Great question. So marijuana in and of itself actually is different from tobacco in that it actually can cause memory problems. And so I often recommend, unless you're using it for medicinal reasons and you feel like this is necessary, I generally recommend avoiding marijuana use after age 60 because it can mimic and exacerbate memory loss. So it's a total separate process from actually smoking tobacco. It's not so much about your heart and brain health. It seems actually how the drug is metabolized in the brain can cause memory difficulties in certain adults.
Thank you. Let's give a big thank you to Dr. Moore.